My name's Gunaratnam Shyamalan, but everyone calls me Mr. Shyam, and I'm a consultant orthopaedic surgeon with a specialist interest in hand, wrist, and elbow surgery. I looked into lots of other fields of science. I was always interested in science. My father was a psychiatrist, and so I met a lot of his friends at various do's and parties, and I kind of thought that perhaps the two would align quite well. And that's how I became a doctor, really. I did quite a lot of surgical specialties, from neurosurgery to plastic surgery and vascular surgery, which is the vessels. And I found that hand surgery was a good combination of all of them. And so when I came to the end of what I would say my basic surgical training, I'd already done a lot of general surgery already, and I decided that hand surgery was better in as far as for lifestyle, and I enjoyed the small and intricate things. I have a great deal of interaction, not just with my colleagues and the nurses and the staff, but also with patients. And I get to see their results from a very early stage and very quickly to see the improvements that they make. So in a way, it's quite nice for all of us that in that short time scale, we get to see each other and get to see those improvements. And I'm a social person, I'm a people person, so it's a good job for that too. I think they can see lots of other good, credible hand surgeons, but I'd like to think that we form a really nice rapport. I'm very open with the patients, I communicate well, and I want them to communicate with me. So it's not just a consult, it's more a conversation. And then having a management plan that isn't just what the textbook says, but what's right for them. So I think that's probably been my greatest skill. And now I've been doing it for over 15, 20 years. I really do see the benefits down the line because I'm seeing my patients again for other causes, or I'm seeing their family members. And that's a great vindication of the work that I do. I love their feedback. I think it's important that you get a running feedback. And sometimes it's a bit cheeky, and sometimes it's really honest and hard hitting. But I think that's really, really important. And most patients, as I say, we sign an unofficial contract when they're under my care. And that is one of, I'm treating them, but they're also going to try the best to make it work for me. And I think we both meet in that. And some patients, whether it's around sport or music, we do talk about other things that aren't related to work. And I think that's important too, because I get to see a really wide section of society. Absolutely. I like to say activity modification, change things that you do, and joint protection, where splints don't overload the joints quite commonly. Less is more. I think that's a general catchphrase. I like to talk about natural anti-inflammatories, things like glucosamine, fish oils, turmeric, ginger, garlic. Although perhaps it's not the most evidence-based, it certainly stops you taking other medication just for pain relief. And as a general rule, no one needs surgery unless it's urgent. So you have time to try a few things.